Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about some common questions I get for a medication called LoDoCo, also known as colchicine. Plus, I'm going to go over different uses of this medication as well as what you should be aware of while taking it. What is LoDoCo? LoDoCo is a prescription medication first approved in 2023. It's the first anti-inflammatory medication to be approved which demonstrated a reduced risk in cardiac event. LoDoCo is approved for use to lower the risk of myocardial infarction, stroke, coronary revascularization, and cardiovascular death in adults with atherosclerosis or with multiple risk factors for cardiovascular disease. This indication was based off of a recent clinical trial which demonstrated LoDoCo has the ability to reduce cardiac events by 31% when compared to a placebo, all while complementing the standard of care including high-intensity statins in patients with cardiovascular disease. LoDoCo is available as a tablet in 0.5 milligrams and can be taken by mouth once a day with or without food. How does LoDoCo work? The mechanism of LoDoCo is still being evaluated. However, the likely mechanism is linked to reducing inflammation. LoDoCo contains a substance called colchicine which works in a special way to help your body fight inflammation. It does this by affecting certain inflammatory cells called neutrophils, which are a kind of white blood cell important for your body's defense system. LoDoCo makes these cells less reactive, which means that they are less likely to cause inflammation in your body. So why do we want to reduce inflammation for those who have cardiovascular disease? Well, recent research has suggested that inflammation may be the spark that causes cardiovascular events such as heart attacks and strokes to occur. While inflammation is a natural process that occurs in response to injury or infection, chronic inflammation, which can occur in response to lifestyle factors such as poor diet and lack of exercise, can contribute to the development of cardiovascular disease. A recent study published suggested that inflammation strongly predicted mortality after statin use in patients with high cholesterol levels. The study suggested that while cholesterol may be the fuel that is needed for a heart attack or stroke to occur, inflammation may be the trigger that causes it to happen. This study also suggested that inflammation should be considered a major risk factor in atherosclerosis and that high-risk patients who already receive statin therapy should strive to reduce excessive inflammation as opposed to adding additional layers of cholesterol reduction. So linking this back to LoDoCo now, one of the key benefits observed with LoDoCo is its ability to reduce levels of an inflammatory marker in the blood known as high-sensitivity C-reactive protein. And while we know LoDoCo can help prevent serious heart problems and cardiac events, the exact way it achieves this protection is still being evaluated. What if I miss a dose? If a dose is missed, it is recommended to take the missed dose as soon as possible. If it's almost time for the next dose, skip the forgotten dose and take the next dose at your regular scheduled time, but do not take 2 doses at the same time. Can I take this medication if I'm pregnant or breastfeeding? It is important to notify your doctor if you are pregnant or planning to become pregnant, as the potential impact of LoDoCo on the fetus is not fully understood. Similarly, if you are breastfeeding or considering breastfeeding, it is important to inform your doctor as this medication may pass into your breast milk. Discuss with your healthcare provider the most appropriate feeding approach for your baby while undergoing treatment with LoDoCo. If you're a male taking LoDoCo, it is important to keep in mind that this medication could potentially lead to temporary fertility issues, which may impact your ability to conceive. If this is concerning to you, it is important to discuss it with your healthcare provider. What are the side effects of this medication? Well, like all medications, LoDoCo has a few side effects. Some common side effects may include diarrhea, vomiting, abdominal cramping, stomach pain, or muscle pain. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to different medication would be beneficial for you. What are the serious side effects of this medication? LoDoCo may cause serious side effects in some. Some serious side effects of this medication that you should be aware of include low red blood cell counts, low white blood cell counts, and low platelet counts. Symptoms of this may include fever, fatigue, cough, difficulty breathing, pale skin, increased heart rate, lightheadedness, or blood in your urine or stool. Keep in mind that this can be life-threatening or result in fatality. Muscle weakness or neuromuscular toxicity, including symptoms such as muscle pain, weakness, tingling, numbness in your fingers or toes, dark brown urine, severe muscle weaknesses or pain, fever, or tiredness. or allergic reactions including hives, difficulty breathing, or swelling of your face, lips, tongue, or throat. If you are experiencing any of these serious side effects, immediately call your doctor and stop taking this medication. Can LoDoCo interact with other medications? It is recommended to avoid using LoDoCo with medications that could increase your risk of certain side effects. Some of these medications include atorvastatin or diltiazem. Keep in mind that the use of LoDoCo is not recommended for those with renal failure or severe hepatic impairment, those with pre-existing blood disorders, who have a known allergy to colchicine or any components, or who are taking cytochrome 3A4 inhibitors or P-glycoprotein inhibitors concurrently, such as cyclosporin or clarithromycin. It is also recommended to avoid consuming grapefruit or grapefruit juice while taking LoDoCo. Doing so could increase your risk of experiencing side effects associated with this medication. There's lots of information on LoDoCo, cardiovascular disease, and various health conditions on our website, so check out our blogs in the links below. You can even save money with your prescription by purchasing it from our website. We offer free home delivery and competitive prices. And if you have any questions, just drop them in the comment section below and don't forget to subscribe. Bye for now.